All right, hello again, everybody. Today we're going to talk about something a little somber. It might be a little difficult, but we're going to talk about the end of life. So this is going to end our unit on lifespan development. So we're going to take a look at some of the factors in death, some of the emotional and social and cultural behaviors we see when we come to the end of life. So our objectives and standards today to identify the stages of adjustment to death and to explain how society works to accept death and dying. Take a moment there to look at the standards, please. And our desired result, remember to include this in your weekly summary. What are the main cognitive and social changes in relationship to death and dying? Couple of vocabulary words here, sorry. Therontology is the study of death and dying, trying my best to pronounce that. And then hospice is a special place or special places for terminally ill people who go to die that are more pleasant and comfortable. So the adjustment to death. When humans find out that they are terminally ill, they must cope with their approaching death. Now, pioneer work by Elizabeth Kubler-Ross, believe I'm saying her name properly, on, excuse me, on the terminally ill and their impending death, resulted in a major contribution to establishing therontology, which is the study of death and things like that. So what she did was she interviewed 200 dying patients and identified 5 stages of psychological adjustment to dying and death. So here are the 5 stages of death. So the first one is denial. So this is when terminally ill people react by saying it cannot be happening to me, or they might say I'm going to get another opinion, and sometimes they might even refuse treatment or question their doctors. So the first stage again is denial. The second phase of death is anger. So people may ask, why me? They want to know what they did wrong in their life or why it's happening to them. They may become angry with others, or they might become angry with, if they're a religious person, they may become angry with a higher power, such as God. A person may also alienate themselves from others. They don't want to, be with their family or friends. They kind of, seclude themselves and things like that. Stage 3 is bargaining. A person may try to bargain with fate. They may ask God, again, if they're a religious person, for more time, if they're good, or they may try to bargain for a lesser illness or diagnosis. Number 4 is depression. People start to become aware of their losses. They might become aware of their loss of their hair. They become aware of loss in their body weight, etc. So they become aware of their physical changes, and that can depress them. They also may become depressed because they're aware that they're going to lose their family and friends. They know that their life is coming to an end, and they're going to lose their family and friends. And then the final stage of death is acceptance. This is when a person understands that their struggle is over and they begin to become calm. It seems like they become calm, relaxed, they're very serene. They don't look scared or upset necessarily. They may still be, but they've come to accept it and they become very peaceful. They may appear a little detached, like you're not really, like, if you're talking to them, they might not be listening to you. They might be looking around the room, or not really talking a lot, but that's because they're coming to grasp that their life is ending. So dealing with death. Now, not every person goes through the stages. Some people might skip around a couple of stages, or some people might not even go through them in the same order. Some people might bargain first and then become angry, depressed, and then face denial and then acceptance. Some people might go through acceptance first and then become angry or denial at the end. So again, people can go through it different ways. Family members and friends also struggle with the death of a loved one. I'm sure many of you have been through this yourself, and it's difficult. And even myself and others I know, it's never an easy process, and we all go through it in a different way. To support family or friends that are dying, people should provide support and care. We should be there for them. We should support them in their decisions, and we should care for them in their final, days or months, whatever the case may be. It's also important to provide respect for them, self-confidence for the old person, and also dignity, so providing them with a sense of honor and dignity as they're going through the final stages of life. It's also important to keep an open communication about legal and financial arrangements. So it's important to understand some of the legal situations and some of the financial situations as well, to avoid any maybe confusion or frustration after the person has passed away. Now, talking about death. The discussion of death is still uncomfortable for most Americans. People are afraid to talk about death, especially if they have no direct experience with them, if they've never, really dealt with it on a personal one-on-one basis. Now, in 1900, most people died at home. So about 100 years ago, it was usual for someone, when they were sick or elderly, to pass away at home. So people were familiar with that. Today, most people die in hospitals or in nursing homes. Unfortunately, not unfortunately, but most people die in hospitals and nursing homes. So the reason we have kind of a difficult understanding of death, or we find it difficult to talk about death, is because sometimes we're not there in the room when that person dies. So people kind of don't want to think about being in the room when it happens, or want to be there, or whatever the case may be. So that's kind of a distant thing. That in 1900, people were a little more understanding of death because they saw it more frequently when someone was older. Now, there is the help of hospices. Now, a hospice can help restore the dignity of dying, or make someone feel more comfortable about dying. It's designed to make the patient and their surroundings more pleasant and comfortable. Now, hospice doctors, it's important to know, do not attempt to prolong life. So they're not there to necessarily cure the person or help save their life, but they're there to improve the quality of life. They're there to make them as comfortable and as peaceful as possible in their final days or weeks. Patients live mostly normal lives in hospices. They can receive care such as tranquilizers or drugs to help with pain or discomfort. And at any time, a person can choose to leave the hospice center and return home to die. I know, like my grandfather, when he was sick, he chose to return home to pass away, and they had like a hospice set up there for him to pass away peacefully. Now, nursing homes are beginning to provide hospice services and information as well to the elderly, to make them more comfortable in nursing homes as well. And like I mentioned earlier with my grandfather, there is home-based hospice care, which is becoming more frequently used in the U.S., where you can return home to your own house or your own location, or maybe to a child's location or something like that if you don't have a house anymore, to pass away there in the comfort of family and friends as well. So our closure. What cognitive and social changes occur in relationship to death and dying? Think about the stages of death. Think about how we kind of comprehend death and react to death, and then some of the services that are in place to help those who are dying become more comfortable with death, and also those who are dealing with the death of a loved one, help them become more comfortable with it as well. Hope you have a great rest of your day or night. Please let me know of any questions or concerns, and I hope to talk to you all soon.